1/3 of all women that initially get on birth control, within 1 year, they get off of birth control. And the reason why is because of side effects, because of symptoms, headaches, migraines, different things that it seems to cause in their bodies with the disruption of hormones. If you've been on birth control long term, you almost certainly will develop thyroid dysfunction. It's a game changer for a lot of women, it really is. And it can be very helpful, and I would recommend and suggest that if you do take it, that it's short term. All right, welcome again to the Be Well Now podcast. We're going to talk today about something that is very, very uncomfortable for Nick, but he's doing it so well.
Listen, last week we talked about menopause. This week we're talking about birth control, and I said, please start this again. You're the doctor.
Yeah.
I'm Nick. I'm a curious patient. I love talking about acupuncture and getting your blood
Chinese medicine, labs,
all the things that you do that are interesting to me. But listen, all medication has side effects. And I saw an Instagram story recently where another kind of, functional medicine doctor was talking about the side effects of birth control. And I was like, ooh, that might be a really interesting podcast. And this is where you jump in and say all your smart things.
Right, absolutely. And there are side effects to every drug, to every medication, and like nutrient deficiencies. Every medication that you take depletes your body of nutrients. And so that's something that you have to counter for. You have to adjust for that. And if you're not being told that, well, that's something that needs to be corrected very quickly. And so definitely today we want to address what are some of the things that you might want to know when you're considering taking birth control.
We were just talking, I said, how does this get prescribed? And you were saying that a teenage woman, a female girl, goes in maybe with their parents and a physician will prescribe birth control, not to prevent pregnancy, but for things like acne and regulating like painful periods.
Menstrual,
and as a guy, I'm like,
pain.
I had no idea. So to the moms out there who might have gone through that, you talk to them in your clinic, maybe they say, hey, my daughter was recommended this. What do you think? How do you approach that conversation?
Yeah, well, the thing for me is I'll say to them, first of all, is we need to be looking at the body as a whole. We don't want to just look at one symptom or one concern that the patient has without addressing what might also be a causative factor. Okay, so we have to look back and say, okay, here's the branch, and we talked about this before. We use this analogy. I love this analogy, but if we have a tree as our analogy, we have a leaf, we have a branch, we have the root. And so what we're really looking for is what is at the root of this issue? What's causing this problem? Because we want to heal it ultimately. We don't want to just cover it up. And so when I have a conversation with patients, the first thing I say is, well, are you really just looking to abate your symptoms right now? Or are you looking to actually heal this for the future? And that's our first question we have to answer. And if your answer to that is, well, I just want to cover it up, or I just want to feel better now, then okay, absolutely, that might be your best approach to do birth control or to do some other type of hormone therapy. But if your answer is, I actually want to put in the work that is required and do what is necessary in order to have healing long term, then we need to be looking deeper and saying, where is this coming from? What's at the root?
As in, like, maybe why am I having acne and all these things? Let's talk about the benefits. Like, let's just start with like why people get prescribed birth control. Well,
absolutely. They'll get prescribed birth control because it is very, very effective, first of all, at stopping pregnancy or preventing pregnancy, right? And that's because it literally does prevent the body from creating the ovum or creating essentially the follicle. It prevents follicle stimulating hormone in the body from being being produced. And so in that way, it actually will suppress ovulation. So if you can't ovulate as a young female or as a female, then you're not going to be able to achieve pregnancy. So it's very effective at that. But secondarily, it is and has been shown to be effective as well for regulating those hormones for women. So it helps with regulating their hormones if there's some sort of hormone dysfunction, or let's say it gives them a little more estrogen or gives them a little more hormone than they currently are experiencing. And so
that sounds pretty good.
Well, yeah, and it actually makes them feel pretty good as well. And there's a suppression of the period itself. It's not really a true period when women are on birth control, they're not really experiencing a true period. They don't ovulate. Okay, so if you don't ovulate, you're not really having a true period, because ovulation is what essentially triggers the initiation of menstruation. And so if you're not ovulating, there's really not a whole lot of point in menstruating. And so the bleeding that occurs is really more like a false period. And there is bleeding. It's usually very light, or much lighter than otherwise would be when you're on hormone replacement or when you're on birth control. But again, it's not a true period. You don't ovulate, and there's no necessary buildup for a thickening of the lining of the uterus to be sloughed off. And so it's going to be a lighter period. And so as a result, if it's lighter, then you're not going to have heavy bleeding. You're not going to have, in a way, you're not going to have significant menstrual pain, premenstrual pain. You won't have a lot of that. And so, yes, does this birth control help? Absolutely. And it's a game changer for a lot of women. It really is. And it can be very helpful. And I would recommend and suggest that if you do take it, that it's short term, that you have a strategy for long term, because this isn't really a long-term strategy. And one of the reasons I say that is because it's been shown in research that if you use this long term, if you are on birth control long term, almost 80 to 90% of women long term develop thyroid issues. So thyroid dysfunction is in your future if you're utilizing birth control long term. And long term is like a decade.
Okay, like if you use it for a decade.
Mm-hmm.
Thyroid issues don't sound so bad. Why should I care about thyroid issues?
Well, thyroid affects almost every cell in our body. Thyroid hormone itself, T3, when it gets into the cell, it revs our body up, it revs the cell up, it helps with mitochondrial function. It also helps to produce energy for the body. And so it's really what kind of revs that cell up. There's another competing hormone called reverse T3, and if it gets into the cell, it kind of suppresses. So there's a competing interest there. But thyroid hormone is so important for virtually every function in our body. And so if we don't have sufficient supply of thyroid or thyroid function, we're going to have brain fog. We're going to have constipation, bowel-related issues. We're going to have difficulty focusing, concentrating, things like that. And so a lot of these symptoms are symptoms that women begin to express later on, even in their 30s oftentimes, some in their 20s. But if you've been on birth control long term, you almost certainly will develop thyroid dysfunction.
Okay, so it's something to care about. It's hard to care about the long-term stuff when you're young, but
oh, absolutely.
I know this is a
I just need this now.
Yeah.
There is another option. I made it seem like there were only two options. The other option is, okay, can we address this now by using some birth control possibly, and then implement herbals or implement dietary changes, maybe look at my blood and see where things are and if there's some sort of metabolic dysfunction. But one thing that can happen is, again, if you're on these hormones, they'll make your body feel, they'll give you the sense that everything's okay, that your symptoms have resolved, which they have mostly, and therefore that the root or the organ dysfunction that was existing, that was creating those symptoms, has been resolved. And the reality is it has not, because all you've done is you've painted the leaves on that tree. You went out and you noticed that the leaves are problematic, or the branches, right? I'm having a symptom here. And you went out and you painted those leaves, and you didn't make any fundamental change to the body or the physiology. So now at the moment you decide, you know what, I want to stop this. I don't want to be on birth control anymore. What happens is you begin to get those symptoms again. And that's because you haven't addressed the underlying root problem. So we need to get to root causes, and we need to address what's happening at the root.
I don't think a lot of people think that way.
No,
from the peptide world out there
pill.
And the TRT people, because I follow more like in the men's health world, and I just feel like people want to feel better in their bodies. Life is really hard. And if you can relieve symptoms so people can go to bed and keep working and, pursue the dreams they have, or take care of their family, or whatever it is they're doing in their life, it's just so hard to feel good in your body, And so you just want to address the symptoms, and then, okay, now I can deal with the other stuff that's more important or whatever. And so it's just, I think it's really important to, so why do women get on birth control in the first place? Obviously, preventing pregnancy is the number one reason. Are there other compelling reasons why you'd want to get on birth control, or why physicians prescribe it?
Yeah, absolutely. There are multiple reasons, and some of those are like painful or heavy periods. That's probably the second most common reason to get on birth control, is for painful or heavy menstrual period. Okay. Third, I think, is acne, and we talked about that. And beyond that, there's not a lot of other reasons really that people are put on birth control.
And then when do women typically start? And if I sound like the ignorant man here, I apologize, but I think it's important to kind of like, let's start from the beginning and then like work our way through.
Yeah, the typical age, that's what you're asking, right? The typical age for women to start or to be prescribed it is around 16 years old. I had a patient recently talk to me, and he said that his daughter, she had gone to college. She hadn't been on hormone replacement or birth control at this point at all. And she was, first of all, your diet when you go to college is usually really poor.
Yeah.
Right. Your lifestyle, your sleep, very poor sleep, high stress.
Not
it's like
you, but in my time, it was a lot of alcohol as well. Just like
alcohol,
very unhealthy.
all sorts. Yeah.
Just not
college is
abusive to the body.
Not a prime time for like organ support. It's not like support my body. I'm feeling like I'm in my prime. And yet we do. Like that is kind of our prime. Yeah. And yet it's our time to like slash and slay and do all of these things that we think are super fun that we should all do, but it's really like kind of destroying our bodies, right? So really, we should be looking at supporting our bodies throughout that time and maybe changing some of these things or adapting. But who am I? We all have to go through a learning process as well. And that's part of our learning process, is seeing how we feel after we wake up after a drinking bender or something like that, right? So, but the patient, he told me, he said, my daughter went in, she's in college, she went into a doctor, the school doctor or school nurse or something. And then she mentioned that she was feeling these ways and she was having some menstrual irregularity as well. And they said, you know what, let's just put you on birth control, no problem. We do that with lots of girls. And so she had mentioned that to her dad, and her parents were like, wait, what? What do you, they were very alarmed by it, that they wanted to put her on birth control. Obviously she wasn't sexually active, and she wasn't in a situation where they felt like she needed it. But absolutely, it's one of the most commonly recommended things if you have menstrual irregularity, acne, as a young female. And they're likely going to be recommended to go on birth control.
So you get on it. I mean, I'm talking about pharmaceuticals in my own experience. I've been on SSRIs and everything. You get on it, and then you have these consultations. And then if you stop going to see the doctor, they're not going to reach out and be like, hey, how are the antidepressants working out for you? They're just going to keep renewing the subscription, and there's no exit strategy. So
we always want an exit strategy.
With
You're
females.
using my language, Nick.
Well, it's because I'm telling you, these pharmaceuticals that you get on, and it's like, oh, I just take this forever,
Yes.
When do women get off it? Is it difficult? Like, let's talk about the off ramp if women decide to get off it. And then we can talk about some other things too, but just kind of the nuts and bolts of this all as an ignorant man.
This is one thing that I share with my patients as well, and the mothers when they ask, which is typically the ones that are asking. But 1/3 of all women that initially get on birth control, within 1 year, they get off of birth control. And the reason why is because of side effects, because of symptoms, headaches, migraines, different things that it seems to cause in their bodies with the disruption of hormones that it's causing. Okay. So getting on birth control is not something that's like light and simple. It definitely has its side effects. It definitely has problems. Those can be mitigated, of course, as well, but mood changes, weight gain, headaches, all of those things are reasons that women get off of it. Within 2 years, 50% of women get off of the medication, the birth control. And so, the other reason generally that women would get off is because they're wanting to have a pregnancy. They're wanting to have a baby. And so they choose to get off of their birth control. We spoke recently or had a podcast recently about menopause. And I mentioned this what we do during our, teen years, our 20s, our 30s, and how we treat our bodies and what's been done to them, right? And so this is one of the things we do, the stage that we set for menopause. We're doing it now. And so if we're looking back, if I'm a mother, if I'm a father, so I look at my kids and I think, what can I do now? What can I be doing now to help prepare them for the life they're going to have? And if I'm in a place where I don't like the menopause, perimenopausal phase that I'm going through, I'm going to be looking back and say, how can I change that for my daughter? How can I make things nicer for her? How can I improve things for her? And how can I have a conversation now with her to say, these are the things that are helping. These are the things that I wish I would have done differently at your age. And I would recommend to you to do them differently as well. Well, this is one of those things. Do we really want to be covering up those symptoms as we have been taught in our society to do? Or should we initiate in a way to say, let's really get to the root of what's going on and let's solve this issue so that in the future, when you are menopausal or perimenopausal, you're not having to have significant swings and significant mood changes and significant pain, right? And sweats all times of the day so that you can actually just ease through that nice lifetime.
Is there scientific evidence to suggest that getting on birth control will make your menopausal symptoms worse?
I don't have any scientific evidence to suggest that, but it does. What it does do is it makes it worse because it's covering up symptoms. It's covering up the underlying condition. Okay, so let's say, for instance, one of the things is PCOS, right? PCOS can be covered up, like the underlying signs, polycystic ovarian syndrome, can be covered up, essentially underlying by birth control. So the symptoms are there. We see the symptoms, and
That's a sign there's something wrong, right?
Yep, that's a sign
with
there's
the organs.
Yes, exactly. So we're seeing the symptoms, and we can address them and treat the organs, and the organ dysfunction will ameliorate, and so will the symptom. Okay, but instead we can just cover it up with birth control. If we cover it up with birth control, then it's just sitting there waiting. It's waiting essentially to present itself. It's constantly still dysfunctional. It's just we're using hormones to suppress the fact that we're experiencing that. Okay? So then later in our life, now what we're having to do is constantly be on hormones and synthetic hormones. Now, some of the other symptoms and reasons that you may not want to be on hormones is, number one, again, thyroid issues. Why would I not want to be on hormones long term? If we get on hormones, we're saying, okay, we have to be on this either for life, up and down, constantly adjusting our hormones, or we can say, hey, I want to actually address the problem. I want to address the issue at the root so that we can become more healthy, so that we can actually have an easier move through life, so that we can be vibrant, right? So many women get into the phase of life later on when they're menopausal, perimenopausal, and their hormones are absolutely shot. Their thyroid is dysfunctional. They have insulin-related or blood sugar issues. All of these things, if they were on birth control, have actually been covered up and now are blaring in their face. And basically what it does is it sets them up for a time of, if they want to be symptom-free, they either have to dig deep now into the organ dysfunction, or they just have to keep covering it up with hormones. So why would you not want to be on hormones long term? It causes thyroid dysfunction. What else does it cause? Well, it causes deficiencies in vitamins, in minerals, and nutrients. It causes deficiencies in magnesium, in zinc. Now think about it, magnesium and zinc. Those are like super important for your immune system. Right? And super important magnesium. Right now, a lot of articles are being written on the fact that like 80% of people in the United States are deficient in magnesium. And it's like, how many of you are taking a medication or are consuming something that depletes the body of magnesium? And if you are, then you should certainly be on that, right? You should be taking magnesium. Okay.
Well, let's talk about it. If people are on birth control, they're on it. What advice do you have for being on it? Is it periodic breaks? Is it nutritional supplementation? I mean, we're not here to totally vilify it because we know people are on it. So let's give them some suggestions on how they can be well now.
What you'll want to do is if you are on it and you're taking birth control, you'll want to make sure that you're taking Vitamins and nutrients like vitamin B, which it depletes, magnesium, zinc, quercetin, and selenium. You want to make sure you're taking those for sure.
And
absolutely.
you have supplements that would help.
And we can provide those.
Here at Community Health and Wellness.
Absolutely, recommend them. The other thing is you want to be, thank you. Thanks for plugging that.
You do this for a living?
Yeah.
This is the real deal? Okay.
And and also you'll want to make sure you're taking a really good omega, like a really good oil. You should be getting deep, rich oils, good quality. It could be olive oil. We've talked about this as well on a podcast. Nick can direct you to that. He might even put a link right here for you.
Okay.
There you go. I set you up. So, but, good quality oils like olive oil, avocado oil, tallow, ghee is a really good oil as well. All of those oils can be very beneficial to your overall health. Okay. The other thing that you want to do is you want to make sure that the things that you're consuming in your diet are going to be anti-inflammatory as opposed to pro-inflammatory. So breads, pastas, carbs, sugars, processed, refined foods. Try to get as many ultra-processed foods out of your diet as possible because they're going to be pro-inflammatory and it's going to lead to more pain, more dysfunction, more hormonal disruption, right? And if you can just eliminate those or change your diet a little bit, it will make either your menstruation phase much better or even your perimenopausal, menopausal phase. It'll be much easier for you to move through. So those are some things that you can do.
And then what about periodic breaks? Can you end up doing that and then you get pregnant and you're like, I never should have gone off it. I could just see all the things that could.
Yeah. Periodic breaks is essentially something that I recommend for anyone that wants to be on hormone replacement therapy. You should be taking periodic breaks because you need to kind of get an idea of where my body actually is and how much am I really able to support my hormone systems myself? Am I able to produce those hormones still? My organ systems, have they completely shut down? My kidney, my adrenals, my pituitary, my hypothalamus, all of those organs need to be producing hormones. They produce them for you. But if they're getting the feedback loop all the time that there's plenty or there's too much, then they're not going to be getting the signal that they need to be producing more. So we do need phases where we're off so that those organs can be challenged to make the hormones that they should be making in order for us to have essentially balanced physiology and balanced health.
All right. So I think it's now worth talking about does weight gain happen?
Yes.
I've heard that as like a side effect.
It can. Weight gain can happen, mood changes, headaches.
Is that with birth control or going off?
When women get on it, oftentimes it will happen. So that was in one of the when women get off of it. Oftentimes it's because of some of the side effects. Sometimes they'll gain weight. Sometimes they'll have mood changes or irregularities. They'll have migraines from it or headaches, and so oftentimes they'll go off of it. But again, the vitamins, the zinc, the B2, B12, B9, B6, all of those vitamins are super important for you to include in your diet, and your magnesium.
So how does it actually affect like the vitamins and like the thyroid? Like what is birth control doing? Because wouldn't you just take it and feel better and think everything's great?
Yeah, you do take it and you say, oh man, I'm feeling pretty good right now. But what happens is it also interferes because hormone development happens and occurs at a variety of different organs in the body. And so it will, basically what it will do is the clearance of the vitamins, it speeds the clearance of those vitamins from the body. And so you develop this function or this pathway that essentially clears. Remember when we talked about certain plants that are, they're bioenhancers? And they'll actually clear certain medications from the body faster than otherwise. Well, these medications have a tendency to clear vitamins from the body through those same type of detoxification pathways. So they enhance the clearance of those vitamins and those minerals so that your body almost doesn't even get to utilize them.
And we want those vitamins and minerals. What else do you feel like expressing?
You know what? I honestly think that I'm going to review just this quick story again.
Okay.
Because I think it's an important one to understand for a lot of people. And that is, when we are young, before we start menstruating, before his testes drop and before she starts menstruating, what happens? What regulates hormones? That's a question I have for everyone to think about. What regulates your hormones before then? It is the organs of your body that are responsible for secreting and producing hormones. And those are the kidney and the adrenals, the hypothalamus, the pituitary, and that HPA axis, the hypothalamus, the adrenals, the pituitary, are secreting hormones so that we have hormone balance. And think about the hormones during that time. Did you feel hormone disruption? Did you feel significant problems during that period of time? Maybe you did, and maybe there was a hormone dysfunction that needed to be corrected. But would you have suggested that it had anything to do at the time with your menstruation or with your testes, if that was the case? And the reality is no, because those aren't even active. They're not secreting any hormone. They're not balancing any hormone at that time. So it's not until you actually start menstruating or the testes drop that those hormones really become more fully active. And then we see the physical changes in men and women as well around that time. So what's happening, we have this period of fertility, or this season of fertility. And at some point, we're going to let that season set. And there should be a very smooth moving time. You should move very smoothly from the season of menstruation into the season of post-menopausal. Okay, so how do we do that? That's the question. How do we move into that season? Well, we have to take care of those organs that are responsible for hormone production. Those same organs that produced the hormones prior to your menstruation and prior to that season, are the exact same hormones that are going to be regulating it on the back side. So we have to make sure that the kidney, the adrenals, the liver, the hypothalamus, the pituitary are all taken care of. And what we see with women oftentimes who are on hormone replacement is that it can really affect hormone replacement or birth control. It can really affect their lipid panel. And part of that's because of the blood sugar. It can really impact insulin resistance, or the way insulin is utilized within the body. And so we have to really...
That's a precursor to diabetes and all kinds of issues, right?
Yes, that's a precursor to diabetes. And we have to look at how is the body managing properly those organs, right? Are those organs in good order, in good shape? Is the lipid panel in good order? Is the liver happening? Are the liver enzymes in good order? And we need to be testing the thyroid to see where it is. And if the thyroid's showing dysfunction and you're on birth control or you're on some hormone replacement, then that discussion really needs to be had with your prescribing provider.
So this is something where you can get your blood levels tested. You can get your labs through someone like yourself at Community Health and Wellness in Heber City, Utah. And you can take all these factors into consideration and offer someone a path forward. Hey, yes. I want to stay on birth control. Help me supplement, or give me some advice. I want to get off it, or should I go on it in the first place? There's tools that can be accessed, and then there's a functional health perspective or a healthcare provider perspective that can help kind of guide you through what steps to take next.
Absolutely.
So it's kind of a customized thing. I mean, I'm a mom out there, and I'm like, hey, I want to put my kid on birth control. What do you think?
Yeah, if I'm asked by a parent, hey, I want to put my kid on birth control, my role as a physician is to support you. I'm here to support you in your decisions. I'll give you questions maybe as well. I'll say, have you considered this? Have you considered that? Have you considered the fact that most women who go on birth control actually get off of it within a year or within 2 years for sure, because of the symptoms, either weight gain, headaches, migraines, things like that. Those are things to consider, right? Also, have you considered other options? Have you looked into potentially herbal medicine or changing diet? Because diet and exercise and herbs have actually been shown to be very effective with menstruation and gynecological related issues. I mentioned before, Chinese medicine is one of my big specialties. It's one of the things that I'm expert at and I use a lot. And I do really believe the more I study and the more I utilize the herbs and the plants with patients, I learn that the sensitivity of Chinese medicine to the female physiology is way more sensitive than our Western physiology. It's just than our Western medicine. Our Western medicine is usually about just covering it up, blocking it, stopping it, chopping it off, replacing it, right? That's really what we do in Western medicine. Chinese medicine is all about harmonizing, balancing, nourishing, supporting, tonifying. And if that's what you're looking for, which is what I provide, that's what we provide as physicians here at Community Health and Wellness. If that's what you're looking for, then that's the life of longevity. If you're looking for a long, happy, sustained life that is vibrant, then what you want to do is sustain your organs over time, not just cover up symptoms that you have.
Ooh, let's end there on that mic drop. The Be Well Now podcast.
Be well now.
Be well now, everybody. And if they want to learn more, how can they reach you at Community Health and Wellness?
You can reach out to us at chwheber.com, or you can also call our phone number at 435-657-3696.
Namaste.
Namaste, everyone.